You good? We good? 6 feet or more. Well, good afternoon, and thank you for joining us for this press conference. I'm Rob Pitts. I chair the Board of Commissioners of Fulton County, and I'm joined by Dick Anderson, our county manager, and Dr. Elizabeth Ford, who is the interim district health director for Fulton County. Since March 2nd, when our governor announced the first 2 COVID-19 cases in Georgia, both of which were here in Fulton County, the number of cases has increased to 187 as of today, which means that Fulton County is the epicenter of the virus here in Georgia and represents more than 20% of the cases in the state of Georgia. Today, the Fulton County Board of Health declared a local public health emergency in our county. This allows us to take extraordinary measures to protect the health and well-being of the citizens from the spread of this outbreak. And Dr. Ford will go into more detail about what the impact of that action that was taken by the Board of Health means. What I'm doing in my role as chair of the Board of Commissioners of Fulton County is to encourage the mayors and councils of each of the 15 cities within Fulton County to adopt uniform rules and regulations. Uniformity among the 15 cities is key so that our citizens will have a clear understanding of what is permitted and what is not permitted. I do not have the legal authority to require the cities to do this, but since this is clearly in the best interest of our citizens, I have no doubt that our mayors and members of council will comply with our requests. At this time, I'll ask Dr. Ford to go into greater detail regarding the order that was approved by the Board of Health.
Good afternoon, and thank you, Chairman Pitts, for your support in trying to maintain the health and safety of the citizens of Fulton County. As your interim district health director, I have been directed by the Fulton County Board of Health to limit all gatherings to fewer than 10 people and to restrict all activities of non-essential businesses to 10 people or less, and to restrict all of their business activities throughout Fulton County that require direct human contact. We will work in consultation with the board to define what are considered essential services as it relates to this declaration, but this declaration has been made in an attempt to maintain the health and safety of our citizens by encouraging physical distance, as has been recommended by the Centers for Disease Control and the Department of Public Health for Georgia. We are supporting the chairman's request of all other municipalities within Fulton County to adopt this legislation so that we may have consistent rules throughout the county, which will allow protection of all of our citizens along the same measures. Thank you.
Mr. Manager, would you like to say anything regarding Fulton Industrial District, that area?
Yes, Dick Anderson, County Manager. So as it relates to the Fulton Industrial District, where Fulton County still maintains the authority and responsibility to execute municipal services, we will be implementing these guidelines as outlined by Dr. Ford and their respective restrictions.
All right, are there questions? Any questions?
I just want to ask you, how do you guys feel about the legislation you guys have adopted right now, and what you think it's going to do for the citizens of Fulton County?
So your question is, what do you think this legislation will do for the citizens? So I think this will make it safer for citizens to feel comfortable sheltering in place and performing the recommended levels of physical distancing as has been recommended by CDC and Georgia Department of Public Health. Having it ratified by the Board of Health and by Fulton County government should make it easier for businesses to enact these restrictions. That is correct. And then for food services, we are recommending takeout only, and additional essential services will be defined in consultation with Fulton County Board of Health. Sure. So statewide, we have over 1,000 cases already, and if you think back to last week, it was in the 200s. So these numbers are growing dramatically. We're basically doubling every 2 days. Fulton County is number 1 in the state. We have nearly 200 cases, and so that means we have approximately 20% of the burden for the entire state, which is why it's so critical that we enact some kind of legislation that supports protecting our citizens.
Great question, and what we actually, several cities have already enacted legislation. However, the problem, it varies. So this actually establishes a baseline, and which means that some cities, for example, the city of South Fulton has a curfew. Other cities do not have a curfew. So, but we're concerned now about the baseline. Some have already adopted legislation. Some are in the process of adopting legislation. I spoke as recently as within the hour with Mayor Reed from Chattahoochee Hills, and he is meeting with many of the mayors in South Fulton now to encourage them to do exactly what I'm asking to be done. The manager has spoken with mayors up north, and I think I can say the same thing for up north as well. So I think that because this is a public health emergency, because our Department of Public Health through our interim director has acted, I expect no resistance from this whatsoever. Well, one of the things, and I'll just, from my perspective, one of the things that I'm learning is that there needs to be, going forward, much more and much better coordination. That's obvious not only at the federal level, but it's also true at the state level, and even within county government. Going forward, I think we will have a plan that will be in place. In fact, in addition to what's happening within Fulton County, I've also been talking with and meeting with my colleagues who, meaning the chairs of the surrounding counties, to find out what they're doing, let them know what we're doing, and if there are things that they're doing that we are not doing that we can adopt, and vice versa. So it has brought a lot to light, and that although I think we're in good shape here in Fulton County, we can do better, and we are doing better. And 50 years from now, if we were to be faced with a similar situation or something even worse, the roadmap would be there for whoever the leadership is in place at that time.
No, we are keeping in sync with the governor's declaration, which right now speaks to the end of March, but is subject to renewal upon notice.
All right, thank you very much. Oh, by the way, one other thing, 6:30 tonight, we'll have a virtual town hall meeting, and we're asking everyone to tune in, beginning at 6:30 p.m. I'm not familiar with that.
So the declaration that is currently in place is sort of a response to that. I think to answer your question about the challenges of trying to protect citizens who have varying levels of regulation, it's my hope that the Fulton County legislation that I'm presenting right now will be the baseline, and if people want to enact stricter regulations, that is perfectly fine, but we need to at least have some consistency throughout the county, and really ideally contiguously in Metro Atlanta, so that we can really all bind together to protect our citizens. So I think that the mayor's restrictions are fine as long as they are consistent with what we're recommending here in Fulton.